Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Each week we cover topics related to the pre-med journey to medical school and beyond, from the MCAT to completing your application and from starting medical school to choosing a specialty. Our podcast will provide essential information for anyone contemplating a career in medicine.
By now, you probably have gotten a little bit of a start on your secondary applications that we discussed a couple weeks ago, and they will continue rolling in throughout the summer. But once the secondaries are completed and schools will have time to review your entire application of your primary and your secondary application, they'll start sending interview invites. Interview invites usually come the earliest, sometimes in July, the end of July, but usually will start really rolling in August, September, October is when most people will begin getting interview invites. Schools will send out an invitation to interview, and usually what they'll do is that they'll give you multiple dates, usually about a month ahead of time to choose from. So let's say you get an interview invite in August. They may ask you to interview in early October and give you maybe 5 or so dates to choose from that work for you. So once you get that interview invite, it's important to respond to that school immediately. So within a couple days, thanking them for the interview invite if possible, and then confirming which day you choose. It's important also to try to make the day that they offer or one of the dates that they offer. So I have received a lot of questions from people asking me, well, it's going to be kind of hard with work or school to make that certain date. Can I ask the school to give me a different interview date? I recommend trying to not do that as much as possible unless there are very extenuating circumstances that are happening that you just can't make that interview date. This time in the application process, your focus should be on getting into medical school and making every effort to make an interview when offered. So if there's very extreme circumstances and you can't make a specific date, it is okay to reach out to the school and ask them if there's a different date that you could choose. But I recommend trying to the best of your ability to attend one of the offered interview dates. So after you've received the interview invite and confirmed it, the next important thing is to figure out what the interview day is like at that school. So there's 2 types of interviews and then a combination of those 2. So you can either have a traditional interview day or you can have something called the multiple mini interview or MMI interview. So about 50% of schools use the MMI interview and about 50% use a traditional or a combination of both. So let's talk a little bit about what the traditional interview entails. So usually the traditional interview entails you showing up at the school around 8:30 to 9. You may have a breakfast with the dean of admissions or some people that are part of the admissions or some students. Usually you get to converse a little bit with other medical school applicants that are there for their interview. And then they usually will give you a tour of the school, talk to you about different things like financial aid or the curriculum or kind of just various things that the school offers. And then you have your interviews. So most typically what I've seen is the interview consists of 2 interviews. So you have one usually with a faculty member and one with a student, a current medical student. This, of course, varies between schools. Some schools will have you interview with 2 faculty members. Some schools will have you have 3 interviews, or some schools even have you interview with a panel of people. Definitely varies between schools. But for the most part, the traditional interviews will be the one-on-one type interview where you sit down with somebody in an office or in a room and they ask you various questions. Why do you want to come to this school? Tell me about yourself. What's one of your greatest challenges you've overcome? Why do you want to be a doctor? All of these kind of typical questions. And again, this is the first of many podcasts that we'll have on interviews. So I just kind of wanted to introduce the interview concept, what to expect at its very basics. And in the future, we will talk more about these individual questions and kind of give some examples on how to answer these as well. With the MMI interview, your beginning of the day will probably be very similar. You'll probably come, have breakfast, have a tour, etc. And then you'll break up with the other applicants to go to the MMI interview. So the MMI interview typically consists of 6 to 10 stations where you are given a short prompt, usually 2 to 3 sentences prompt. And the prompt will either give you a clue to what is going to happen next. You're either going to walk into a room and talk to an actor pretending to be a patient. You may talk to somebody just sitting there and they're just going to listen and possibly answer follow-up questions. You may talk to an actor playing just an upset friend or something like that. There's tons and tons of different MMI scenarios, but usually the MMI scenarios are all going to revolve around some kind of ethical or moral situation or dilemma that you have to discuss and try to solve in the scenario. So again, you have about 6 to 10 stations depending on the school. What will happen is usually you'll go to your first station, you'll get the prompt, you'll have a couple minutes to review the prompt, and then you'll go into the room and begin. And in the room, depending on the school, you'll have a various amount of time to just discuss that prompt or interact with the patient actor. And usually that's about 6 to 10 minutes. So let's just take, for example, unethical questions. So there could be a lot of different things on medical ethics or ethics regarding certain patient situations, but let's take physician-assisted suicide. Let's say your prompt is discuss physician-assisted suicide, the pros and cons, and take a position. That could be your prompt. And you get a couple minutes to review that. You walk into the room and there's somebody sitting there. You should walk in, introduce yourself, and then you have 6 to 10 minutes just to sit there and talk about physician-assisted suicide and try to answer each different aspect of the question. So as you can see, this is something that will really require a lot of preparation. Most people are not ready just to go and do an MMI interview off the bat. We recommend reading a lot of different MMI scenarios and then practicing them over and over again and practicing as many scenarios as possible so that you can really be prepared for any scenario that they throw at you during the interview. Most often, even people that have practiced tons and tons of scenarios, they do not have that same exact scenario during their actual MMI interview, but they'll have something similar. So that practice will allow them to apply what they've learned and what they've practiced to a different situation. So again, we will definitely talk about more MMI scenarios and we'll even go through some of them and give some examples and things like that in the future. But I just kind of wanted to get you thinking about it and kind of have an expectation of what it's going to be in the next few months. Finally, just to give a quick overview, following the interview, you'll go home, and then within the next couple of days, we recommend that you send thank you letters to the interviewers. If possible, if you had that traditional type interview, send a thank you letter to the admissions committee in general for interviewing you, and then send a thank you letter to those specific interviewers. MMI is a little bit more tricky because you probably won't know those specific interviewers' names or those evaluators. So instead, you can just send a general letter to the admissions committee thanking them for the interview day and expressing your interest in attending their school. So that's a little bit about interviews. Again, right now, I really want people just to focus on secondaries and get those secondaries turned around as quickly as possible. We have tons of information on secondaries at Prospective Doctor. You can find all of the old prompts there so you can start preparing them and get them turned around right away once you start receiving them. But I just wanted to give you a little bit of a heads up of what to expect after that. Interviews are exciting. They can be nerve-wracking for sure, but it is an exciting part. One person had told me when I was interviewing is that you kind of already have your foot in the door. So when you get offered an interview invite, the medical school already likes you on paper. They already think that you could be a good candidate at their school. Now they just want to see you in person and confirm that you are personable, you can have a conversation, and that essentially you're normal. So that's the great thing about interviews, is that they are actually a very exciting time because medical schools already like you. And so you can feel pretty confident walking into interviews. But again, that doesn't necessarily decrease the amount of preparation you need to do.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at prospectivedoctor.com and medschoolcoach.com for more essential resources in your medical school journey and beyond.